Zinc is a very important trace mineral. Now, the definition of a trace mineral is a mineral that's needed in smaller amounts. Some of the other minerals like calcium and magnesium, iron are needed in larger amounts, but a trace mineral is usually needed in smaller amounts. Zinc is considered a trace mineral, and it's very important for anybody involved in bodybuilding or fitness. It's important for other things I'll get to in a second, but you should know that zinc is involved in the synthesis of testosterone. If you don't get enough zinc, or if you're deficient in zinc, you'll also be deficient in testosterone. In third world countries where zinc deficiency is more common, they've given men who, young men who have had a long-term zinc deficiency, they've given them zinc, and their testosterone levels zoom through the roof. This doesn't mean that taking zinc is going to boost testosterone in men or women who have normal testosterone levels. In other words, that only applies if you're deficient in zinc. A couple of years ago, they came out with a supplement that was very popular. I think it's still around. It was called ZMA. It was a complex of zinc and magnesium and the amino acid aspartic acid, and it was touted as a kind of a testosterone booster. It was actually quite popular for a while, but there was some truth to the fact that some people got some real benefit from it. And the reason was that some people can actually, even in this country, in the United States, can actually have borderline low zinc levels that would adversely affect their testosterone level. Zinc is also involved in the metabolism of growth hormone, another popular anabolic hormone produced in the body. Without zinc, you don't get a optimal growth hormone release. Zinc is also involved in insulin metabolism. Zinc is needed for the synthesis of insulin in the pancreas. So you have the three major anabolic hormones, and zinc is involved in all of them. So in that sense, you could say zinc is a kind of an anabolic hormone. Lately, with the COVID-19 pandemic, zinc has also come into focus because apparently it's needed to absorb certain other nutrients into the body that would tend to block the ACE2 receptor that the COVID-19 SARS-CoV-2 virus, it needs to interact with a receptor in the body called the ACE2 receptor. And zinc, and along with some other nutrients, which I've discussed in previous videos, and also in my Applied Metabolics publication, appears to block that effect. It blocks the virus that causes COVID-19 from attaching to its certain receptors in the body. And oh my God, hold on a second. Let me turn off this phone. Wait a minute. Hold on. Oh. And what happens is, I forgot to turn off my phone. That's the price I pay. Hold on a second. Hold on a second. Hold on a second. Hold on. Wait. Hold on a second. Wait. Sorry about this, but it's going to keep ringing if I don't turn the damn thing off. Hold on a second. I hate these phones. Wait a minute. Hold on a second. Wait. Hold on. Okay, now I'll be all right. Sorry about that. But anyway, as I was saying, zinc is involved in all these anabolic hormone synthesis, so it's important for that. But it's important also to emphasize that zinc will only give you effects. I was talking about the ZMA, that's what I'm talking about, the ZMA supplement. Some people actually men in particular, got some benefit from it because it turns out that in many cases, surprisingly, they were borderline deficient in zinc. So if they take a supplement like ZMA that has zinc in it, they're going to get a definite effect, maybe even a slight boost in testosterone, but it was only because they were deficient in zinc. It's hard to imagine how anybody who's consuming a high-protein diet could be deficient in zinc. I'm not sure how this happened to these men, but also magnesium is another mineral that's very often borderline deficient, because it's found in certain foods like leafy green vegetables and vegetables that people don't, a lot of people who are on diets, they don't normally consume them. So they can also be low in magnesium. So if they take ZMA, they'll get a little bit of a boost. But again, I just want to keep emphasizing that that the zinc supplements work best if you are borderline deficient. Now, this leads to the flip side of zinc. What happens if you get too much zinc? Now, there's a lot of problems with if you ingest too much zinc. In their zeal, a lot of people will read that zinc is involved in testosterone metabolism. So they have this idea that if they ingest more zinc, they'll have higher production of testosterone. This is why you see a lot of so-called testosterone boosting supplements. Very often they include zinc as a component. However, again, zinc is limited in how much it can affect testosterone. If you have normal levels of zinc in your body, taking extra amounts is not going to do anything to increase testosterone anymore, but it could lead to some problems. So zinc is involved in over 100 chemical reactions in the body. And most of the time, it functions as what they call a coenzyme, meaning it's needed to activate certain enzymes in very important reactions. I'm not going to go into all the reactions. It happened. I just mentioned the hormonal effects, but I'm not going to go into it. But let's say that DNA is also involved in the synthesis of DNA, deoxyribonucleic acid. This is the blueprint of cells. It's very important. You want to keep your DNA healthy and stable, because if DNA gets mutations, there's various ways it can get mutated. Then that can cause cancer. Zinc is involved in taste perception. If you are lacking zinc, you will also lose your perception of tasting various things. Zinc is very important for wound handling. It's very important for immune function. As I said, they found that having optimal zinc levels offers some degree of protection against COVID-19, especially the most serious subsequent effects that can happen, such as acute respiratory distress, where you have to go on a respirator. If you're replete in nutrients like D, vitamin D, and zinc, it'll probably prevent the infection from progressing that far. The reason so many people get so sick where they have to be on these respirators or they possibly die from COVID is usually a combination of very, very weak immune systems, which is also related to nutrition, and poor nutrition itself. A long-term deficiency in a lot of minerals and vitamins will set you up where if you get an infection like COVID, you're in big trouble, and all these medications won't help you. The doctors and physicians are not helping at all because they tell people to avoid taking any type of supplements. They say that vitamin mineral supplements aren't necessary. This amounts to medical malpractice because most people are not eating a lot of the foods that these essential nutrients are contained in. So when a serious infection or a pathogenic organism, when they're exposed to something like that, their protection is down to nothing because they listen to the idiotic advice given by many physicians not to take supplements. You need supplements if you're not getting these nutrients in food, like, for example, even zinc. If you're not eating foods that are rich in zinc, and you don't take a supplement that contains zinc, you're going to get in a lot of trouble. Now, conversely, we're talking here about overdose. Well, first of all, what's the maximum amount of zinc you should intake without getting into any problems related to overdose? That would be 40 milligrams. 40 milligrams of zinc. That's what they've said. They call that the upper tolerable level of zinc, meaning if you take 40 milligrams of zinc, you won't have too much problem. Years ago, I was taking a supplement called what was it called? A food replacement, a meal replacement, and I was taking a mineral supplement, and I was taking a vitamin mineral, and one day I just calculated my zinc intake, and I was getting over 100 milligrams of zinc a day. And that's problematic for reasons I'll get into. That's way too much zinc. Among other things, a study a couple of years ago, it's a weird effect. Zinc in optimal amounts of zinc helps to prevent prostate cancer in men. However, if you get too much zinc, you can actually promote prostate cancer for reasons that aren't clear. This was shown in a study of physicians. They found that the physicians that routinely consumed 100 milligrams a day of zinc or more had higher rates of prostate cancer. Now, there's no cause and effect relationship there. In other words, zinc itself does not cause prostate cancer. It's what they call an observational study. In other words, zinc may or may not promote prostate cancer in large doses, but they just found that the men who regularly consumed higher amounts of zinc of 100 milligrams a day or more had greater rates of prostate cancer. It might have been from something other than the zinc. That's the way these studies are. They're not. Some of them are not precise, especially observational studies. You'd have to do a randomized clinical trial involving a placebo and the real stuff to get more accurate results. But I just mentioned that. So if you want to get your zinc from food, as I said, high protein foods are rich in zinc. That's why it's hard for me to imagine how any bodybuilder or anybody involved in fitness, people who are involved in those activities, almost always consume a higher protein intake. So I don't understand how anybody who's eating a high protein diet could possibly be deficient in zinc. But zinc foods that are rich in zinc include meat, fish, seafood, certain cereals. Oysters are the richest source of zinc. A 3-ounce serving of oysters contain 291% of the daily requirement of zinc in a 3-ounce serving. This is probably why oysters have been associated with kind of an aphrodisiac effect over the years. People think if you eat zinc, it increases your sex drive and your sex performance. It's probably because of the zinc that's in very high amounts naturally in oysters. There's been no reports of zinc overdose from eating food sources of zinc. In other words, even if you eat varied liver, for example, is another good source of zinc. Years ago, when I competed in bodybuilding, desiccated liver tablets were one of the most popular supplements. Frank Zane, Mr. Olympia 3 times, myself, many others, we took huge amounts of liver tablets, anywhere from 50 to 100 a day. And because of that, we were getting very large, probably, I don't know exactly how much, but we were getting a large amount of zinc. None of us ever experienced any signs of zinc overdose from the natural source liver. So you're not going to get a zinc overdose from eating foods, but zinc poisoning, as they call it, it could happen if from dietary supplements. As I said, if you could wind up taking, maybe each supplement has only 20 milligrams of zinc, but if you take several of them, you can easily get to 100 or more. That's what happened to me a couple of years ago. Luckily, I never experienced any signs of zinc overdose. I don't know why, but I didn't. Probably because I was balancing it out with another mineral called copper. That's another story I'll get to in a minute. But zinc, there's certain household products that contain zinc that you could be exposed to. People who use denture adhesive creams, they also are loaded with zinc. You can get zinc. Zinc can be absorbed through the skin. It can be inhaled. So certain industrial jobs, if you're working them, you can inhale zinc through the air and wind up getting a zinc overdose. Of course, this doesn't apply to people who don't work in industrial jobs. So let's look at, just so you know, what are the signs of zinc overdose? Well, the most obvious is nausea and vomiting, and I'll quickly add that there are many, many causes of nausea and vomiting. So, if you ever experience nausea and vomiting, don't right away think it's a zinc overload. It might be other things, but if you're taking too much zinc, it can cause nausea and vomiting. A 2012 review of 17 studies that looked at the effectiveness of zinc for treating the common cold and reducing the duration of a cold found that adverse effects were common. The review found that the people that took zinc had a 64% higher risk of nausea than people in control. Now, let me explain. A couple of years ago, they came out with a study showing that zinc lozenges, not necessarily zinc supplements, zinc lozenges, if you take zinc lozenges, you just let it dissolve in your mouth at the onset of a cold, like the common cold, it not necessarily prevented the cold, but it greatly reduced the duration of the cold. Let's say the cold would normally last 5 days. If you took the zinc lozenges, it would last 2 days or something like that. Unfortunately, latest studies show that the zinc, the theory was that the theory of why the zinc lozenges were effective is because the zinc lozenges, they kind of coat the throat, the upper respiratory area. That's where the cold virus first enters the body, and zinc itself is toxic to the rhinovirus. The virus that causes the common cold is destroyed by zinc. So you could get the theory there. The theory was by having the zinc present, it would kind of knock out the cold before it had a chance to take hold, so you'd be better in 2 days. Unfortunately, subsequent studies over the years showed that zinc was not quite as effective as they thought. However, some studies still confirm that taking zinc lozenges can help reduce the duration of a cold. But again, you don't want to go crazy. I think that this 2012 study, the people that had nausea probably overdid. These zinc lozenges were flavored, they were tasty, they were almost like candy. So these people figured, well, one of them contains 15 milligrams of zinc. I'll just take 10 of them over the course of the day to maybe have the cold disappear even faster. That's when they went into trouble, because they wound up getting a zinc overload and it gave them nausea. Sometimes if you have a toxic amount of zinc, if you vomit, you'll actually see blood in the vomit. It'll look like coffee grounds. It's a serious condition. You got to get to a doctor or a hospital right away if you see something like that. Very uncommon, very uncommon. I've never heard of it in anybody over the years. I've never heard of a single person that experienced that from taking zinc. Another possible sign of a zinc overload is stomach pain and diarrhea. Zinc poisoning can cause stomach pain and diarrhea. If you take too much zinc, you get a very watery diarrhea. You'll be going to the bathroom every 5 minutes. Too much zinc can irritate your gastrointestinal tract and cause irritation. That's probably what causes the diarrhea. Then you could get, with too much zinc, you could wind up getting symptoms that look like the flu. It would be like symptoms such as, this happens mainly in industrial factories where they inhale zinc fumes. Zinc is a common chemical used in the industry, and it gets in the air and they inhale it, and they get flu-like symptoms such as fever, chills, cough, headache, and fatigue. It's not the flu. It could be caused by too much zinc getting in their body. So that's, again, more or less limited to people that are breathing in zinc fumes. It's unlikely to happen with any dose of a zinc supplement. One of the real problems with zinc, as far as other things, is zinc. There's a protective form of cholesterol called high-density lipoprotein. High-density lipoprotein circulates into the blood, and it helps remove excess cholesterol out of the blood. It transports the cholesterol to the liver, where the excess cholesterol is converted into bile, and then it's excreted out of the body. Because the body cannot burn cholesterol like it burns fat or anything else, this is the only way the body can get rid of excess cholesterol. So having higher levels of HDL cholesterol is considered cardiovascular protective. And by the way, taking oral steroids, any oral steroid, even the so-called safe ones like Anavar and Winstrol, rapidly lower your HDL cholesterol, because what they do is they stimulate an enzyme in the liver that degrades HDL cholesterol. Every bodybuilder who I've ever known, and I've seen countless lab tests from bodybuilders, every one of them that was taking oral steroids, even small doses for an extended time, like right now they have this idea that you can, I think it's called cruising, where you could stay on low doses of steroids all year round. Well, get that. That's going to also stimulate that enzyme in the liver that's breaking down the HDL, so you could wind up with heart disease, even on the so-called safe doses of oral steroids. So taking excess amounts of zinc, when I say excess, I'm talking amounts habitually of over 60 milligrams a day of zinc orally, will probably adversely affect your HDL. It's very not good for your cardiovascular health. It's very dangerous. So you got to be careful of that. Another effect is zinc is needed for the sense of taste. So if you don't have zinc, if you have an outright zinc deficiency, you can lose your ability to taste things. Coincidentally, loss of taste is also one of the initial signs. Loss of taste and smell is one of the initial signs of being infected with COVID-19. I don't know if that's related to zinc or not. Zinc lozenges and syrups, they can cause a bad taste in your mouth. So, that's not really related to this, but so it can cause, if you have outright deficiency, you can lose your sense of taste. One of the most overlooked problems that I've seen over the years with people who take too much zinc, zinc and copper have a kind of antagonistic relationship. Copper is another trace mineral. It's needed to prevent a certain form of anemia. It's needed to produce collagen in your body, which is the main protein, structural protein of connective tissue. If you don't have enough collagen, your connective tissue could break down. You could have stuff like joint pain. You could premature aging, and the aorta, the large artery leading from the heart, actually starts to break down, and when you have a copper deficiency because of lack of collagen. Unfortunately, if you take in too much zinc, the zinc and copper kind of compete for uptake in the body. And if you take in too much zinc, you wind up either losing copper or not absorbing as much copper as you need. Now, you don't need a lot of copper. All you need is about 2 to 3 milligrams a day. As a matter of fact, too much copper is also very bad, because free copper, meaning copper normally travels in the blood attached to a protein. I believe it's called ceruloplasmin, if I remember correctly. It's been years since I studied biochemistry, but anyway, it's normally bound to a protein, copper, but when it's free, it's considered very reactive, just like iron. And when it's very reactive, it produces these oxygen byproduct, toxic byproducts called free radicals. And in the brain, excess copper and iron have been associated with Parkinson's disease and Alzheimer's disease. So you don't want to get too much copper either, but you need a certain amount. Without copper, you don't even absorb iron, so you have to have a certain amount. If you want to know the correct ratio to copper to zinc, it's about 3 to 1. In other words, you don't want to get more than 3 times more zinc than copper. And if you're taking in the more zinc you take, the greater the chance that you're going to be deficient in copper. The type of copper anemia caused by copper is called sideroblastic anemia. And you can also have a deficiency of certain white blood cells, and the medical term for that is neutropenia. So if you for some reason, if you're taking in, you have to look at your supplements, look at your diet. If you're consuming more than, let's say, 50 milligrams a day of zinc, it might be a good idea to if you're not getting the copper. And by the way, copper is found in all the protein foods. Liver is loaded with. It's easy to get copper in the diet. Even water contains copper. But if you're getting a lot of zinc, over 50, 60 milligrams a day, you might want to think about taking a little copper supplement, but you want to make sure the supplement doesn't contain more than 2 milligrams of copper. You never want to take more than that, because, as I said, copper could be very toxic also. When you have zinc, is, as I said earlier, is very important for immune function, and if you're deficient in zinc, you're going to have a lower immune response, which opens you up to all kinds of diseases, not just COVID-19, flus, colds, you name it. But there's a U-shaped curve when it comes to zinc and immunity, meaning you have to have a certain amount of zinc to keep your immune system working properly. But if you go past a certain point, it actually depresses immunity. What happens is when you take excess zinc, it reduces the function of T cells. T cells are very important. Killer T cells, for example, are the immune cells that actually attack viruses and bacteria and prevent you from getting sick. Vitamin D, one of the functions of vitamin D is to basically turn on T cells. That's why vitamin D is important for immunity, but if you excess zinc will actually reduce the function of T cells and open you up to a lot of possible infections and diseases. So those are the main problems. Zinc, along with copper and other nutrients, they follow I mentioned this many times in my Applied Metabolics publication. There's a principle called hormesis. Hormesis, in simple terms, means something that's really good for you and beneficial in small to moderate amounts can turn toxic past a certain point. The same stuff can turn toxic. Zinc is a perfect example of that. Copper is another example. Even exercise. Everyone knows what happens if you overtrain. If you train properly, you can make muscular size and strength gains. But if you overtrain, it reverses, and you either don't make gains or you actually can lose muscle. This is hormesis, and zinc is prone to that. If you do there's medical treatments if you do wind up getting an overdose of zinc. Some of the doctors will prescribe ulcer drugs like H2 blockers or proton pump inhibitors to reduce stomach absorption, because you need acid for zinc absorption. Sometimes, if it's a really bad case, they'll put you on an intravenous drip that provides a drug called disodium edetate. And what this stuff does is it binds to zinc in the blood, pulls it out of the body. It's a form of what they call chelation therapy. So those are some of the treatments for excess zinc intake. And again, I just want to point out that I personally, I don't think offhand, can't remember anyone I've ever met in bodybuilding and fitness who actually experiences zinc overload, because other minerals will, if you like, for example, calcium, magnesium, they also kind of compete with zinc for uptake. So they basically more or less keep zinc honest. If you're taking the other minerals, they'll control the uptake of zinc, and they'll prevent you from going into a zinc overload. This is probably why zinc overload is almost never seen in bodybuilders. There are some, like I said, there's been some cases like these people who respond to that ZMA supplement I mentioned earlier. They might have been borderline zinc deficient. Again, how that can happen, I have no explanation for, because again, if you're eating a high protein diet, the odds of being deficient in zinc are almost zero. I can't see how that could possibly happen. It only happens today in this world. The only place you really see larger numbers of zinc deficiencies are in third world countries, where people don't have access to this kind of food, and they live off, let's say, certain grains or something like that don't have enough zinc. And some of the vegetable sources that do contain zinc, unfortunately, contain what they call anti-nutrients, like phytic acid, oxalic acid, which I wrote about in an article in Applied Metabolics called Anti-Nutrients. These substances found that naturally exist in vegetables and grains will lock onto minerals like zinc and actually prevent them from being absorbed. They'll pull them out of the body. You're probably saying, well, does that mean that people who are, let's say, vegans or vegetarians who only eat these foods are going to have a zinc deficiency? No, because if you as soon as you heat these foods, you destroy most of the phytic acid and oxalic acid. It breaks down. It's more of a problem if you live mostly on raw foods. If you eat a lot of raw foods, you could theoretically wind up with a deficiency of zinc. And to underscore what I'm saying, and I've seen various studies where they've checked the nutritional status of vegans. Vegans are people who only eat fruits and vegetables, no animal proteins, and a lot of them are either borderline or outright deficient in zinc. Now you know why. So that's about it. That's about all I'm going to say for zinc overload. It's an important mineral. You want to make sure you get it. If you're eating high protein foods, you don't really have to worry about it. If you, for some reason, you're taking excess calcium and certain other minerals that can compete with zinc, then you might have a problem. But again, it's unlikely. So, don't worry about zinc. It's very important it is very important for testosterone, insulin, and growth hormone, which are the three primary anabolic, and also IGF-1. It's because it's related to growth hormone. Zinc is involved in that too. So I'll leave it at that. If you want more information on nutrition, exercise science, ergogenic aids, hormonal therapy, anti-aging research you can do today, effective fat loss techniques, in other words, techniques that really work, women's health and fitness, many other topics. I cover more topics in applied metabolics than any other digital publication. It's 30 to 40 pages every month, no ads. It also includes my 62 years of constant study and empirical experience, as well as academic knowledge from studying over the years. I guarantee no matter what your degree of education, you will learn something each month in applied metabolics. Each issue comes out on the first of the month. Again, there's no ads, just pure evidence-based information that includes my own experience, which is, you can't attach a number to that. It's invaluable. What else can I say? If you, when you subscribe, if you send me an email, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on exercise, science, nutrition, and medical health benefits. So also I have an email portal on my Applied Metabolics webpage where current subscribers only can send me short questions about anything they might have read in Applied Metabolics, or anything that comes to mind about nutrition, exercise, and I will answer their questions, because that's like a bonus for their subscription. I appreciate their support of my work, and of course I only answer that question submitted by current subscribers of Applied Metabolics. I don't answer unsolicited questions. You're welcome to leave comments under these videos about possibly future video topics. If I feel they interest a larger number of people, I will try and do a video on it. Again, these are all bullshit free videos. There's no frills, there's no dancing girls, there's no cute cartoons. There's only solid evidence-based information. I think anyone will get benefit from these videos. There's no charge for the YouTube videos. So what I'm saying here is, if you feel that my videos are of value, please subscribe to my channel, this channel on YouTube, and also tell others, because there's too much BS on a lot of these YouTube videos are just crap. And and I'll give you a little tip so you'll know what to look for. Be very wary of videos that list an advertisement. In the information box under the video, your red flags are things like give the code 604 and you'll get 20% off products from so and so company. If any video that has those kind of ads, or ads where they're selling cups and T-shirts and all that crap, be very wary of them. Those are basically commercial sites. The people that do those videos are aligned with the companies that they're pushing. You can't verify whether the information they're giving you is accurate. I am not allied with any company. That includes both my Applied Metabolics publication and these videos. So anything you hear is going to be the truth. I have no access to grind, no ulterior motive. So that's about it. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog, and thank you for listening. Take care.